Our next segment features a panel discussion on state public health perspectives as part of the National Association on Chronic Disease Directors Building Resilient Inclusive Communities Initiative, otherwise known as BRIC. I would like to introduce the moderators of today's session. Vish Vasani, Associate Director for the Center for Community and Environmental Health at NACDD, and Mara Galic, Technical Assistance Manager at the Building Resilient Inclusive Communities, NACDD. Joining Mara and Vish are our esteemed panelists. We have Tiffany Bransteitter from the Pennsylvania Department of Health, Janna Simon from Illinois Public Health Institute, and Christopher C.J. Johnson from the Hawaii State Department of Health. There will be a few minutes of Q&A at the end of this segment, so we welcome you to please submit any questions for the panel in the chat. Mara and Vish, I will turn it over to you.
Great, thanks, Jillian. So happy to be here and welcome everybody to our session on social connectedness, a public health perspective. So as with many other issues, the need to advance social connection as a public health priority has really been amplified as a result of the COVID-19 pandemic. So our session is going to focus on a public health initiative here in the US called Building Resilient Inclusive Communities that will highlight public health as an ally in the social connectedness space. If we can go to the next slide, thank you. The BRIC initiative is led by the National Association of Chronic Disease Directors in collaboration with the Centers for Disease Control and Prevention's Division of Nutrition, Physical Activity and Obesity, and the Division of Population Health. And so before we get to our panel and hear from them, just wanted to warm us up a little bit with a couple of poll questions. If we could run the first two questions. So the first one is, we'll just take a few seconds, is to what extent do you engage with public health in your social connectedness efforts? And then for those that who responded like here or there or not at all, we would love to know how interested you are in engaging public health. We'll give that a few seconds. Okay, so it looks like the majority, 46% of you are engaged with public health in your social connectedness efforts, and really great to see that 69% of you are really interested in engaging public health. And we really hope that through today's session that we spark an idea or connection that you may not have thought of. Thank you, so we'll close that. If we could go to the next slide. So the BRIC program addresses three strategies: improved nutrition security, safe physical activity access, and of course, greater social connectedness, reducing social isolation and loneliness, what we're here to talk about today. Health equity and social justice principles are integrated throughout the implementation of these three strategy areas with the goal of creating resilient, inclusive communities. And the overall strategies that are implemented are policy, systems, and environmental change, which in hearing all the sessions yesterday, the systems approach is really aligned with the work that we are doing. So next slide. So the BRIC, we have 20 states that are implementing the BRIC program, as you can see on the screen, and they collectively are working with 63 communities across the country addressing nutrition security, physical activity access, and social connectedness. The majority of those 20 states are through state health departments and a public health organization in that state. Next slide. And so here in our panel today, we have three of our states, Illinois, Pennsylvania, and Hawaii, very early for Hawaii, here with us today in the panel. to talk about their work on social connectedness. And I think it's really important to say that although, social connectedness has not explicitly been a part of our traditional public health approach and efforts, it's our hope that through the BRIC program, we are able to meaningfully and strategically really build partnerships and bridges with other partners, some of you on this call, in working in this space, and really inform future public health practice. So we hope that through today's panel, we inspire some greater connection. So in the next part, we're going to actually now engage our panel, and we have some questions. The first one is, and if we can go to the next slide, is really for all our three panelists, Janna, CJ, and Tiffany, to tell us about your social connectedness effort in your state and what's happening. Janna, we'll kick it off with you.
Great, thank you, Mara. Hi, everyone. I'm Janna Simon. I'm the director of our Center for Policy and Partnership Initiatives at the Illinois Public Health Institute. And through BRIC, we've really been working with two regions of Illinois. One is our Southern 7 region, and one is St. Clair County, which is sort of East St. Louis area. And I want to really touch on some of the partnerships being built in St. Louis. The Egyptian Area Agency on Aging is working really closely. Sorry, this is Southern Illinois. The Area Agency on Aging is working a lot with one of their local health centers, Shawnee Health Alliance, and they are really thinking through how to create some partnerships and referrals into the telephone reassurance programs that the Area Agency on Aging has been hosting, especially during COVID, as well as connecting to a new sort of IT and training program. So there's been a big push, as you know, to increase access to technology and broadband and such to help older adults especially connect during the pandemic. And so they're trying to create some partnerships to develop referral systems from people who are identified as in need of those services and into the program. So there's this nice health partnership going on with the aging system to really increase that work. And similarly in St. Clair County, there's a faith-based community coalition, MTC, working with their Area Agency on Aging to address and adopt and build some systems around an art therapy program that is out of UCLA. So the addressing loneliness through movement and art. They are really trying to create, again, some referral systems to identify older adults and youth who are interested in the program, connect them into the program, and create some more partnerships between these sort of community-based coalition groups and some of the services being offered. So partnerships is a huge part of what we're doing. And I will say some of the other events around nutrition security and physical activity are also promoting social connectedness. The photo here on the bottom left is a group who recently did a community walk audit in Cairo, Illinois, and they came together in teams, and it was really a nice community event to come together around volunteering together. And on the bottom right, there's some community gardening work connecting to food pantries in the region. And again, bringing community together to help cultivate the garden and get the food into the food pantry. So partnerships is really helping us build the systems, and the social connectedness is a result of a lot of the work we're doing. So I'll turn it back to you, Mara.
Thanks, Janna. And I like how you integrated some of your social connectedness and physical activity work. Really great. Next slide. Tiffany, I wonder if you could share with us some of your work in Pennsylvania. Not sure if Tiffany is available. Maybe we'll go to next slide. CJ, do you want to?
Sure, you bet. Yeah, so my name is CJ. CJ Johnson. I'm with the Hawaii State Department of Health. Prior to the pandemic, my main role was physical activity coordinator with the Chronic Disease Prevention Health Promotion Division. And that means generally focusing on systems, policy, and environmental change that improve equitable access to active living and active transportation. For the past year, like a lot of folks probably on this call, I've actually had a second hat, right, a pandemic hat, and working as our community partnerships lead for the department's COVID outreach and public health education initiative. And so obviously, just like everyone everywhere else, we have suffered from disparities in COVID disease activity, vaccination rate that have closely resembled a lot of our persistent chronic disease disparities that my group tracks. And in Hawaii, that demographic composition of the disparities is distinct from what you see in a lot of the US. Our populations of concern are Native Hawaiian, Pacific Islander, Filipino. Pacific Islander, just as a quick side note, is a very broad generalization that encompasses a number of distinct subpopulations, including Samoans, Tongans, Marshallese, and Micronesian populations. And even within Micronesians, there's a number of cultures and languages. During the pandemic, we worked really hard to identify organizations and leaders that have been working with these communities that, even if they weren't public health partners initially, right, they were delivering food or hosting in-language rent assistance webinars or promoting food drives or translating guidance, or we're trying to support them with resources, capacity, public health guidance, and coordination so that together we can provide COVID outreach and education that's timely, accurate, and informed by community needs and experiences. There's obviously a really strong, I'm really excited to be here, there's a really strong natural connection between active living, disease outreach and education, and social connection, especially in the era of COVID, right, which has proved to be a common challenge for all of those things. And I think nowhere is that overlap more present and more persistent and more challenging than with older adults. Older adults have been disproportionately impacted by COVID. They are disproportionately vulnerable to social isolation, alienation, and many of the supportive programs and environments for both social engagement and physical activity have been paused or defunded because of the pandemic. So we've got a couple of programs that we're really, really proud of. The first one is our partnership with a Trust for Public Land, the Hawaii chapter of Trust for Public Land, that is to support a community-driven participatory design process that's intended to reactivate Aala Park, AALA Park, which is an underutilized city-owned park in the heart of Kalihi, which is a dense, urban, underserved community in Honolulu. The park activation has been including installation of kind of using community experience, interviews with longtime residents, seniors, to capture the history of the park as we work to make it over. The goal here is twofold, right? We want to make sure that Aala Park revitalization will be a supportive environment for social engagement and physical activity, but also that the process itself will help engage folks and help create an environment that's reflective of the experience and values of long-term residents, many of whom have been, again, stuck inside for the last however long couple of years due to some of the cancellation of programming and restrictions on gathering. The other, and we hope this is a pilot, right, in terms of the role that it can have on systems and environmental change. We really hope that we can scale this, and the partnerships that we've built with community partners and park systems will scale into new policies and system stuff. The other one is a partnership with an organization called Pear Suite, which has been working with a network that we've helped put together of agencies, community-based organizations, community health workers, and volunteers to provide us telephonic and web-based support platform for outreach, and that's allowing us to essentially do more. The Pear was created as a platform for well screenings for older adults, and we've actually adapted the platform to connect community health workers and volunteers who have language and cultural knowledge and access to our priority population through technology, through this telephone technology, and through a kind of a CRM platform, right, to connect and help people answer questions about COVID, follow up with their appointments, make sure they make it to their second appointment, see how they're doing. And the goal really of this is to create these connections with the community health workers, most of whom are also community members in the communities that we're serving. And then also, as we transition from COVID all the time response to returning to our chronic disease and physical activity and built environment promotion, that we have this database, right? We have these partners, we know how to reach out to them, and we have Pear in place as a really key partner for getting more out of our community health worker partnerships and continuing to track and log our relationships with our populations that we're serving. So I hope that was not too long, but that's kind of where we're at. Thank you.
That's super, CJ, and I really like that you lifted up the intergenerational connections and the role of community health workers. I think essential in our work. I wonder if we could go back a slide to allow Tiffany to talk about her work in Pennsylvania. Tiffany, take it away.
Yeah, thanks so much, Mara. Sorry for that technical difficulty. Hi, everyone. I'm Tiffany Bransteitter. I serve as the Obesity Prevention and Wellness Section Chief at the Pennsylvania Department of Health, and I'm pleased to be joining you today to talk a little bit about our social connectedness strategies under the BRIC grant. So Pennsylvania certainly isn't immune to the soaring rates of social isolation, and certainly we recognize that social isolation is experienced deeply by people who are marginalized because of their race or income, sexual orientation, gender identity, and location. And we also know that certainly the COVID-19 pandemic has further exacerbated these health disparities in Pennsylvania and shuttered many of our gathering places for older adults that had previously served as some antidotes to isolation. But the good news is that these issues have been recognized by our Department of Aging, and some great social connectedness objectives are included in our 2020-2024 State Plan on Aging, which served as a great foundation for our BRIC work. So through our BRIC work, the Department of Health is focused on really enhancing our partnership with the Pennsylvania Department of Aging, specifically to explore opportunities to embed social connectedness objectives in our state health improvement plan, including education about the impact of social isolation and benefits of social connectedness, not only amongst our stakeholders and public health professionals, but also in our communities. In partnership with the Department of Aging, we are also exploring opportunities to increase the capacity of systems who support older adults in Pennsylvania, to increase engagement of marginalized populations in evidence-based health promotion and improvement programs. And this support system network includes 52 area agencies on aging and over 500 senior centers in Pennsylvania. And at the local level in Philadelphia, we are working to enhance efforts to support healthy living, active engagement, and a sense of community for all older Philadelphians. We are achieving this by engaging community members, including older adults, in community-led and informed community investments, creating more inclusive and intergenerational connection spaces. This included outreach sessions to local senior groups and centers to engage older adults to inform environmental changes in parks and community garden projects, as well as traffic safety improvements. And on the slide, you'll see a picture of Philadelphians participating in the We Walk Philadelphia program, where in some areas that we had made improvements in Philadelphia. In Philadelphia, we're also enhancing a partnership with the AARP Philadelphia and the Philadelphia Livable Community Network, looking to identify opportunities for cross-supportive social connectedness strategies in the Philadelphia area, and also building social connectedness opportunities and programs into some existing community clinical linkage and referral systems throughout the city.
Thank you so much for sharing, Tiffany. If we could stop sharing the slides, thank you. Tiffany, I wonder if I can keep you here. I wanted to ask you, you talked about a number of different partners that you've engaged in your efforts around addressing social connectedness in your communities. I'm wondering if you could share a little bit more about how you built that bridge between public health and those partners, and how you really work to establish that mutually beneficial partnership.
Yeah, so I'm happy to talk a little bit more about that. So I would say BRIC provided a really good opportunity to further engage our colleagues at the Department of Aging. So the State Plan on Aging that I referenced provided a strong foundation to kind of start these conversations, and then the resources that the BRIC grant provided allowed us to really approach the Department of Aging from a perspective of offering support to help advance our common goals. So we are now convening monthly with the Department of Aging and our colleagues there to discuss collaborative opportunities to advance the social connectedness objectives in the state plan, as well as how we can support some of their equity objectives. We also have engaged their executive staff in our Pennsylvania State Health Improvement Planning Task Force to help. So we recently had them present. So we presented on BRIC and we presented on the State Plan on Aging, and they have now engaged as members of that task force to help support integration of social connectedness objectives in the State Health Improvement Plan. And I will say that, you know, upon reviewing their state plan, I did, as a public health professional, and often we serve as conveners of these various partners, I did immediately recognize an opportunity to make connections even beyond the State Health Improvement Plan and the State Plan on Aging. There's certainly opportunities to loop in our Department of Conservation and Natural Resources and their State Outdoor Recreation Plan. So really starting to build those partners in to increase connectivity around how we can advance social connectedness objectives as a whole in Pennsylvania has been really beneficial in advancing that partnership. We also have been, through this partnership and building that trust with the Department of Aging, now have this opportunity to help build up those system supports at more of the local level with the AAAs and the senior centers. So we're excited and looking forward to that in year 2 of BRIC. And then certainly at the local level, BRIC has provided an opportunity to enhance our partnerships with the Philadelphia Department of Public Health and their capacity to work more closely with AARP Philadelphia and the Philadelphia Livable Community Network to spend some more time to intently focus on how they can better connect programs that are already happening in Philadelphia, but how do we make a more conscientious and intentional effort to increase social connectedness across the board. So.
Yeah, and you said something in the very beginning, which is great, just identifying ways to connect around shared goals. And that seems so simple, but is so critical. Thank you for sharing. Janna, I'm wondering if you have anything to add regarding the diverse partners you engaged and how you built that bridge, if there were any specific strategies you used that you'd like to add on to what Tiffany said.
Yeah, thanks, Vish. So our southern Illinois partners, it's a pretty rural area, and so they're pretty close knit already. Most of the folks know who each other is, but they didn't necessarily work together before. And the BRIC funding itself, I think, was a strategy to say, we want to do something jointly on this issue, and we convened partners to create some planning discussions around the use of this fund. So the shared planning helped bring folks together, especially in Southern Illinois. They knew of each other, but to say we're going to do this together and create these systems was really helpful for the plan sharing. And in St. Clair County, the community-based coalition, they've been creating a broader countywide sort of chronic disease coalition. And all of these members, including the AAA and this faith-based group and others, have been part of this sort of new nonprofit that they're creating together. But again, they hadn't worked together. And so bringing the funding in and having a convening and a shared planning session helped the faith-based organization say, hey, we've been thinking about this. This is a huge issue in our community and we want to do something. And they said, we want to start some intergenerational programming. And the AAA said, hey, we've got evidence-based intergenerational program. Let's not start something new. Let's use what's evidence-based. Let's start something and build what we can do to get the community most in need hooked up with what is evidence-based and something we can offer. So they were able to marry those two needs together, or the resource with the need, because of purposeful planning. So the planning and the funding together help bring people together around that.
That's great. Thank you for sharing. In the interest of time, I'll just move to our last question. And CJ, I would love to start with you. If you could share a little bit more about, in your experience and in your opinion as well, what value does public health, whether it's state or local, bring to the conversation about addressing social connectedness with other sectors?
Yeah, and certainly in my perspective and from our, from where I come from in terms of built environment, right? So I'm physical activity coordinator, and I think people always think that means that I'm like the guy that teaches you how to do jumping jacks or whatever. But the reality of it is, what we do know about physical activity and promoting physical activity as a means to reduce chronic disease is that, of course, the built environment, right? The policies in the built environment that either support or create barriers to that are so important. And many of the policies and environmental elements that we're really interested in have to do with creating public space, right? Shared space where people can interact, where people can walk, use transit, bike, use park spaces, places where people convene, places where people use modes other than cars to get around. There's a huge overlap, right, between that and between physical activity, convening for physical activity, whether that's through programming, whether that's in public park spaces, whether that's just hanging out at a public area. I know I didn't hear the entire conference, but it sounds like maybe that's been one of the themes of the conference, right? Is the importance that connection is really important. So it's been really valuable to us. It was a really intuitive. It's something that we've been really interested in for quite some time. And this opportunity, I think, that COVID and the new partnerships that have come from COVID have really just given us a new set of partners to engage with and to try to say that, to try to make the case that this stuff supports their goals as well, and say we understand, try to understand better what they need, what the community's concerns are, and how important that environmental support and policy support for active living, right? And I think active living encompasses social connectedness from my perspective.
Absolutely. Thank you so much, CJ. We did get one question submitted to us for Tiffany. If you could share with us any objectives that stood out to you as promising or successful.
Vish, can you repeat the last the last part of that?
Yeah, it just said, are any objectives standing out as promising or successful?
Yeah, so we're in the very early stages of engaging so we're specifically working with the Obesity, Physical Inactivity, and Nutrition Task Force of our State Health Improvement Plan. But they have started, we have 3 different work groups that fall under that group. And they've started some early brainstorming in terms of how we can cross-support some of the state social connectedness objectives, and also how we can build them into some of our existing objectives. But it's pretty early on in that process, so nothing concrete yet. But I will say, certainly a core value of the BRIC work is equity and advancing equity. So I think something we're very excited about and that I think will be very promising is the opportunity to connect and build capacity in the local AAAs and senior centers to help them reach their targeted populations, because they do such a great job of serving folks who are coming through the door, but often struggle with really reaching the populations that may need them the most. So we're excited about how we can partner and work together to increase that capacity. So very much looking forward to that work.
Thank you so much. In the interest of time, I'll go ahead and round this out. I want to say thank you to all of our states for sharing their insight and their experience. A sincere thank you to the Foundation for Social Connection for inviting us to this forum to share the public health perspective and how the value public health is bringing to this space as far as being a convener, as far as thinking big picture at a systems level, and really continuing to build evidence and inform evidence in this space. I invite all of you to check out our website, which is on the screen right here, to learn more about the Building Resilient Inclusive Communities, or BRIC program, and also reach out to myself or Mara if you have any questions, if you want to connect with any of our BRIC states. We'd love to make partnerships happen. I see a lot of partnerships already happening in the chat, and so invite you all to think about ways in which you can connect with our BRIC states as well. But other than that, thank you all and have a wonderful afternoon.